Okay guys, we thought we'd introduce the Astym to you and kind of show you the techniques that we go through when we're doing this. So again, kind of going back to what type of person would benefit from doing Astym therapy. It's someone that has more of a tendon type disorder. So maybe you're an athlete, or maybe you have some type of work environment where you do a repetitive action all day long. Or maybe it's post-surgical and you have some scars that you're trying to manage, or you have some type of an itis, tendonitis of the elbow, the knee, the Achilles, whatever that condition might be. So the therapy would look a little bit like this. First of all, we would put the patient into a position that is comfortable for them. We want to make sure that they're relaxed so there's not increased muscle tissue as we're going through the process of doing this. We'd want to expose as much of that area as we can. Typically, if I had someone in here for a treatment, I'd probably either have them don a gown or put on one of our t-shirts so I could get a little bit more of the arm exposed. But we're just going to focus on the elbow here today and give you an idea of what the treatment might look like. Okay. So the first thing I'm going to do is I'm going to get out some of the cream, and we're using the cream really to create a sliding surface so that when we apply the tool, it's more comfortable and it's less likely to be disruptive to the skin itself. So we'll use a ton depressor so it stays sterile. We'll take out the amount of cream that we need, and we'll go ahead and put it on to our napkin here. And then from the napkin, now I can use my hands and I'll go ahead and apply it to the forearm. I'll go ahead and get out the tools that I'm going to use as well. So I'll be using 2 tools today, which are, or 3 tools, with one having 2 tools in one here. Okay. So I'll take the cream, I'll apply a little bit to the tissue. Of course, we're always going to make sure that you don't have any type of allergy to the medicine, or I'm sorry, to the cream that we're applying to the person. So we would ask that question first.
All right, go ahead and put your shoes back on.
So the first thing we're going to do is we're going to use what's called the Evaluator. So the Evaluator tool, once again, it has a broader surface on it. It's not going to penetrate quite as deep into the tissue. So when we're mobilizing this tissue, it's going to be a nice introduction to her and help her get a feel for it. So we'll start at one end of the tissue at its insertion, and we're going to come across all the way to the other end of the tissue, its insertion there. Okay. So the protocol really calls for a specific number of strokes and direction of stroke, which separates it from instrument soft tissue mobilization. How's that pressure feel to you?
Good.
Not too bad? Mm-hmm. Good. Okay. So we'll kind of take a look here real quick. So you can start to see how the body is already starting to react to it with a little bit of redness. Increased blood supply to that area. That's really normal. Okay, and that's what I would expect to see that. I was getting a little bit of increase in tissue texture that I noted out here as well as along here. Specifically through here, that's a pretty common place for someone to react a little bit more to the therapy, indicating that she may be an actual candidate for this type of therapy. So we started with strokes of one direction, from origin to origin, or insertion to insertion, and now we're going to go in the opposite direction doing the same thing. Okay. So somewhere between 4 and 6 strokes across the tissue. We'll do that in both directions. Okay. Then we're going to go to the next level. This is where we're going to use the localizer. Localizer, we're going to do the same thing. They're going to be long strokes. This one should feel like it's going a little bit deeper as I go through there, maybe a little bit more localized to the specific area that it's touching. I'm not putting any more pressure through this instrument as I do this. This is the same amount of pressure as applying with the other one. Okay. And again, you can see that the redness is starting to increase there, just indicating that we're having an increase in blood supply to that area. She's really loving it when I go through the thumb right here. I can feel her reacting to it. So definitely this would be indicated for her. Okay. So again, I would repeat that process again. So then we go back to the Evaluator, and we'll do those same strokes. So again, same pressure as I was using on the other one, but what I notice is she's not as reactive with her thumb underneath here, so this one clearly isn't getting as deep to her and isn't as aggravating to the tissue. Okay. And then one more time through with this tool. Okay. And then once we get kind of more through the length of the tissue, then we're going to become a little bit more localized. And so when we start to do, or isolated, so when we start to isolate, we're going to be moving more towards the tendon itself. The tendon is a very strong tissue. The tendon can handle a lot of pressure. The belly of the muscles typically are a little bit more sensitive. So once we get to the elbow, then we're not going to be using the evaluator as much. We'll be using the localizer and the isolator. So we're going to follow the path of the muscles that we're treating. Okay, so we'll just pick one particular muscle group here to kind of work through. Okay, so 2 times 3 with 4 strokes, and then we're going to go a little bit deeper. And this one, I don't know if the audio of the camera can pick that up or not, but we can actually hear the tissue a little bit here underneath this. Okay. And then we'd repeat that again. Normally I'd be working up the tricep here just a little bit, but since she has a shirt on and we're not doing a full treatment, I won't do that today. So that's an example of what the technique might look like as we're working through the forearm. It would be much more comprehensive than that in total scope, but this is a wonderful tool to use if we feel like there's some tendon pathology going on that's limiting our ability to get back to our normal activities.